Hey guys, it hasn't been that long. I told you guys I would give you guys an update. I posted last week. I told you I was going to have an appointment on Wednesday. Today's Friday, so I'll give you an update 2 days later. Um, I went to my OBGYN to try to figure out why I'm getting pregnant, but I'm not staying pregnant. So, he pretty much answered all my questions without me even like asking him the questions. So he's going to send me to a fertility specialist just to go over some things and try to figure out some things. He did order a bunch of tests, blood tests. I had 12 vials of blood taken, the most I've ever had taken before. And so all the test results are going to the fertility specialist. I did get some of the test results back this morning, and the one of the tests, all the tests that came back was negative except for one. One of the tests showed up that I have a autoimmune thyroid disease. So I looked it up to try to figure out exactly what that is. Sorry, a little shaky. And how does that affect infertility? So I looked it up, and basically it's like a something like fluid leaking from the thyroid, causing that goes into the bloodstream, and it kind of attacks your immune system, and it will attack the embryo when you get pregnant, and basically like kills the baby off. So that's makes sense of why I can't stay pregnant. But I also read that there's medication that can be treated with just a simple medication. I'll just have to stay on it throughout pregnancy. I think it's a medication you just have to stay on for the rest of your life. And so, those of you that are struggling with infertility, definitely check that. I have had my thyroid tested many times, and it doesn't come up with the test that they do. So you have to have this certain test done for this autoimmune disease, that autoimmune thyroid disease. So make sure you guys get that tested because I read that it's not a common test to take for infertility, but most women that have unexplained infertility, it could be this disease or disorder or disease or whatever it is. So make sure you ask your doctor about that test if you are struggling with infertility, just to make sure. I did have some other tests done that I have not gotten back. It's like lupus tests and stuff. I'm not exactly sure. I think there's like 6 or 7 tests that's related to lupus. I have not got those back, so I'm hoping those all come out negative. So I'm hoping that this is the only problem, but I do go to a fertility specialist to figure out like what the next steps is, and if I do get pregnant, I'm basically sticking with the fertility specialist until I'm 10 weeks pregnant, and then he's going to pass me back off to my OBGYN. So, which is good because they're going to keep more of eye on me, a closer eye on me, and I'll get more ultrasounds and stuff like that during my first trimester. And like I said, I've had 3 miscarriages, and they're all ended early in my first trimester. So if excuse me. So if I get pregnant and this medication works or whatever, if they found anything else, and if it can be fixed and it works, and I stay pregnant, they can keep a better eye on me, and I'll feel more comfortable as well. Because my OBGYN, he doesn't do first ultrasound until 8 weeks pregnant. So my OBGYN said that the fertility specialist will do it right away. ultrasound, and they'll do it every so often, like throughout the 10 weeks. So that's good news for me. That makes me feel better. So I'm supposed to have another HSG test, which is the dye where they insert the dye and I think like a camera and stuff up into through your uterus and fallopian tubes to your ovaries, and just to check to see if you don't have any blockages or anything like that. So I've had that done twice. Back like 10 years ago, right before I had my first miscarriage. And you are very fertile for the first 3 months after having that done. And I got pregnant the very next month, but I did miscarry. So that's kind of good because I'll be more fertile, but I really don't want to have that done until I can get on the medication I need to be on for this disease. So, anyways, so the HSG, gotta have the HSG done. My doctor mentioned that the fertility specialist, which I already knew, will try to push IVF on me. We can't afford IVF. So he mentioned IUI, and he said my insurance should cover the IUI. And I think he looked it up, and he said he's pretty sure it does. And so we are considering it, but I want to see what just happens first. With knowing what's going on with me now, and hopefully that all the other tests come back okay, and this is the only problem. It'll be a simple fix. So I'm obviously getting pregnant. Got pregnant twice this year. So if I have the HSG done, it makes me more fertile. Maybe I can get pregnant on my own, and hopefully I stay pregnant. So I'm thinking I'm just gonna wait and see if we can get pregnant. I get pregnant right away, or maybe next 6 months or something like that, and then maybe have the IUI if we don't get pregnant on our own. So that's kind of where we're at. I feel like I'm forgetting some stuff. We went over so much stuff. I can't remember everything, but I did mention to him about my uterus lining, because he mentioned that before. Maybe my uterus lining isn't thick enough for the embryo. Well, he said basically it's irrelevant for me right now. He said maybe that's something the fertility specialist will go over eventually, but he said that's not something to look at right now, because there's other things that is going on that we need to look at. He also suggested that I guess he put it in the notes for the fertility specialist to check to see if I need to be on heparin or progesterone injections that I have to give myself. I guess on a daily basis. To stay pregnant, basically, is what he was saying. So if I get pregnant before I see the fertility specialist, I have to call my OBGYN right away. And he's already ordered tests for me, pre-ordered tests for me if I do get pregnant. And he's expecting me to get pregnant. So all I do is call the nurse and tell her, that I'm pregnant, the day that I find out that I'm pregnant. And I go in that day to get the HCG beta test and a progesterone blood test to see if I need to get progesterone injections right away, and go from there, basically. So I feel like we're on the right path now. I still feel like I'm forgetting some information. If I do, I'll add it in my next video. But anyways, I feel like we're on the right path. I mentioned in my last video, I feel like I was getting frustrated and angry. I just want to know why. And I feel like there's been a little bit of weight lifted off from my shoulders. I feel more, I guess, excited, because if this is it, and then once I get put on the medication and everything, then I'll feel more, what was the word I'm thinking of? Confident. So I don't know. We'll see what it comes to. So anyways, I hope that some of you learned from this video. I did see one comment last video. I liked your comment. I'm not sure who you were, but I liked your comment, and the things that you went through, I've kind of already knew about, and it doesn't really, either I can't remember what all of it was, but I've done it, or it doesn't really pertain to me or whatever. So, but thank you so much for commenting. I appreciate that. I want to talk to you guys, and whoever's, watching me. And so please share this video, like this video, and subscribe to my channel to see what's to come. So hopefully, yeah, maybe we'll get pregnant. I do, real quick, I started taking pregnancy tests on 6-DPO last month, and that's when I found out I was pregnant. So just for funsies, today's 2-DPO, and I decided to go ahead and take pregnancy tests. Of course, it's negative. It should have been negative. I feel like it should have been negative on 6-DPO, but it wasn't. And the doctor agreed I was pregnant. He confirmed I had a chemical pregnancy. So I decided, got a lot of pregnancy tests, like the cheapies off the internet. So I decided I'm just going to go ahead and take a pregnancy test every day. This month, because I'm just kind of doing it for the fun of it, but I'm also afraid if I get pregnant and I don't catch it the day that it would show up positive, that I'm going to miscarry. And I'm afraid if I get pregnant this month, I'm going to miscarry because I'm not on the right medications. And so I decided to just go ahead and start testing now, and I'm just going to test every day. That way, if it does show up positive, I can call the doctor right away and get the test done. And if I need to take the progesterone injections, that I can get that done right away. And hopefully, it will help prevent miscarriage. So I hope this helped you guys. If it did, like my video and leave comments. I want to see comments. I want to see what you got to say, and talk to you guys. All right. See you guys. Bye.